Seven symptoms of appendicitis and how to prevent it. Recognizing appendicitis. When you hear that someone has appendicitis, the first thing that comes to mind is chili seeds. Because, during this growing myth that says chili seeds can cause appendicitis. Even though there is no strong evidence that chili seeds are the cause of the disease. Likewise, tomato seeds, guava, or peppers are often accused of accumulating in the intestines to cause appendicitis. Appendicitis is an inflammation of the appendix, which is a kind of finger-shaped pouch that protrudes at the end of the large intestine on the lower right side of the abdomen. In children, the appendix becomes part of the immune system that helps fight infection. In adults, that function is lost because it is replaced by other body parts. But health researchers believe the appendix still functions as a shelter for good bacteria in the body. When a person experiences a disease that affects the intestines, these good bacteria will help fill the intestines so that the intestines can recover. To be sure, people can still live normally without appendicitis if the intestine has to be surgically removed due to inflammation. Appendicitis is of two types, namely acute and chronic. Both of them cause symptoms in the form of pain in the abdomen. Acute appendicitis occurs when a person suddenly experiences severe pain due to inflammation of the appendix. These symptoms cannot be ignored and require immediate medical attention. While chronic appendicitis occurs when the symptoms of the disease come and go for a long time. If appendicitis is not diagnosed, the person will continue to experience these symptoms for years. Who can get appendicitis? Everyone can experience appendicitis regardless of age and gender. However, men are more susceptible to this disease. Globally, appendicitis is more common in people aged 10 to 30 years. In Indonesia, most cases of appendicitis are found in people aged 20 to 30 years. The incidence of acute appendicitis in Indonesia was the highest among Southeast Asian countries with around 10 million cases per year. A person's chances of developing appendicitis are greater if there is a family history of the disease. Children with cystic fibrosis are also at a higher risk of developing appendicitis. Cystic fibrosis is a genetic disease that causes the mucus in the body to become sticky and thick. Another risk factor is the presence of inflammatory bowel disease, such as Crohn's disease, which attacks the digestive tract. These conditions require immediate medical treatment, so as not to cause complications and potentially fatal. Before appendicitis becomes more severe, usually there are several symptoms or signs that appear. Launching Boldsky, here are the symptoms of appendicitis that sufferers often complain about. 1. Right abdominal pain. The appendix is located on the lower right side of our abdomen. When inflamed, you will feel pain in the area. Many people who experience abdominal pain on the right think they have appendicitis. However, you need to be careful. Different from ordinary abdominal pain, pain in appendicitis usually starts around the center. Then, the pain radiates to the right side of the sufferer's abdomen. Sometimes, the pain is also felt to the left side of the abdomen. Pain in the appendix tends to be felt when used for walking, moving the stomach, laughing, coughing, sneezing, even when riding a vehicle across bumpy roads. The pain can be intense within a few hours. So sick, sometimes to wake the patient who was sleeping soundly. 2. Fever and chills. When the infection that attacks the appendix is severe, the body temperature will increase. In addition to fever, sometimes some sufferers have chills. 3. Nausea and vomiting. Not just a classic symptom of gastric disorders. When a person's appendix becomes inflamed, symptoms of nausea and vomiting occur. In contrast to the symptoms of gastric disorders, nausea and vomiting in patients with appendicitis can last more than 12 hours. 4. No appetite. Loss of appetite, along with severe stomach pain and vomiting, can be major signs of an inflamed appendix. Patients with appendicitis often have no appetite because their stomach feels full and bloated. Generally, the bloating felt by people with appendicitis can last for a long time, even after being used to rest at night. This is because the body has difficulty expelling gas, a sign that there is a problem in the intestines. 5. Confusion and disorientation. Appendicitis can also cause a person to experience confusion and disorientation. This is a sign that the infection in your body is getting worse. Because the infection drains a lot of energy in the body, including oxygen. In such conditions, the brain becomes deprived of oxygen supply. Brain function is disturbed. 6. Diarrhea and constipation. Diarrhea and constipation may be one of the diseases that attack us quite a lot. However, if diarrhea and constipation are accompanied by severe abdominal pain for 2 to 3 days, you need to suspect it is a symptom of appendicitis. No less important, monitor if there is mucus in your stool accompanied by abdominal pain on the right. It could be your appendix has ruptured. 7. Blood test. Appendicitis can also be seen from a blood test. If the results of the blood test show high white blood cells, it could be that your body has an infection. High white blood cells in the body indicate the immune system is trying to fight infection disease. If you experience one or more of the above symptoms, consult a doctor immediately. How to prevent appendicitis. Until now, there has been no research that proves some lifestyle changes can be a way to prevent appendicitis. However, some people who diligently eat high-fiber foods such as vegetables, fruit, and whole grains are less likely to develop appendicitis. In addition, to prevent appendicitis, you are advised to keep sugar levels stable by not consuming excessive sugar. According to the Ministry of Health, the recommended daily sugar consumption of each person is 10% of the total energy. That is, people with moderate activity levels are recommended to consume a maximum of 200 kilocalories of sugar, or the equivalent of 4 tablespoons, or 50 grams per day.